Everyone, first of all, I'd like to say thank you to Sinclair team for putting together such a wonderful event. Thank you to all the attendees for such a great turnout. And then lastly, thank you to all the esteemed colleagues, speakers that will be shedding light on a lot of information and already thus far. My name is Dr. John Hendrickson. 27 years in dentistry. At around the 21-year mark, I got a little bit burnt out, as you can imagine, doing anything for that long. So I incorporated facial aesthetics approximately 6 years ago, launched a business model in 2018 under the umbrella of a main company, but several subsidies such as the Dental Beauty Wellness Center and then our Dolly Vita Aesthetics facial aesthetics company. So, you know, we were on a fast track with facial aesthetics, and then COVID occurred. So we had a 10-week downtime, mandatory closure. So instead of just, a 10-week vacation, we decided to continue education, get a lot of study in by way of facial aesthetics. So then when we had our soft opening, we could kind of have a new business model to present to our patients. I studied through the AAFE, became master injector. Our Sinclair devices is really what kind of got us started in all the biostimulation protocols that we used, and then we just kind of expanded from there. So we're doing more bioregenerative treatments today than any other facial aesthetics, and this is only after 5 months of incorporating into the facial aesthetics practice. So it's really amazing, and I have to thank Sinclair for giving me that opportunity to learn such a thing, because it was at a Beauty Boss that I was introduced to this concept of regenerative medicine. So since then, we've been doing these procedures daily, if not multiple times daily. So you've heard it said already, what is regenerative medicine, but specifically in facial aesthetics, just the biostimulation of reparative processes of the face and neck tissues. And I mentioned multiple modalities because there's not one thing that really is key. It really is a culmination of many different approaches. So the big four in our practice, of course, lasers or energy devices, is one thing that I delegate out, and I have a fantastic team that helps me provide services. So that is one thing that I feel that is a huge part of our practice. Threads being I particularly like the PDO type threads, but there's PCL, PLA. Both mono threads, lifting threads are biostimulatory. Radius Sculptro, we use that a lot. And then PRF and biofiller as the most recent. I should add exosomes in there, as we do use exosomes. However, we're using a lot less now that we're using the PRF and the patient's own exosomes for post-op applications on ablative procedures or whatever we might decide. So, we've heard PRP, we've heard PRF. What are the differences? So, PRF generally is second generation peripheral blood concentrate, where PRP was one that was originally concocted. So some of the natural components of PRF include the platelets, leukocytes, monocytes, red blood cells to a lesser degree. But the big thing is the provisional extracellular matrix, a three-dimensional matrix, which is something that tissue engineering requires for most success. So we have that as more of a tissue engineering medium that's ideal suited for reparative processes. There's a wide array of bioactive molecules, including platelet-derived growth factor, vascular epithelial growth factor, IGF, which is the insulin-like growth factor, as Dr. Tacita had mentioned, the EGF, which is the epithelial, or growth factor, the transformative growth factor, and the bone morphogenic protein. So we have chemical mediators for the proliferation, differentiation of cells, the growth of cells, as well as stimulation of vascular components and bone regeneration as well. So there's a lot to be had with PRF. So a little bit of the history. Robert Marks, being an oral surgeon in the 90s, coined the term platelet-rich plasma. So the results is that there's 95% of the concentrate is purely platelets and not much more, which has a benefit of itself, but PRF has much more to offer. Chokran and Dohan developed the idea of the platelet-rich fibrin as the second generation. And then 2019 to present, we have Dr. Richard Myron, Rick Myron. He's a fantastic clinician as well as a researcher. And you might find him, I'm sure, at some Sinclair event down the line. That's where we met him, and that's where we were introduced to the concept of the biofiller. He has over 200 papers himself, which has been amazing. There's been thousands of papers published since the inception of PRP, and it's just been an advancement after another. So how it works is just very basic. Obviously, you have to have someone who's capable of phlebotomy, which should be within all of our skill sets. Me being a dentist, I do all my own phlebotomies. So you get an amount of blood depending on what you're doing. You can produce as much or as little as you'd like. As you can see there, we have a number of vials full. I utilize anywhere from 40 to 60 milliliters of peripheral blood to make my concentrates, and with that I can usually get about a 50% yield of whatever it is that I want to use, whether it be the PRF or the biofiller. So the centrifugation is essential for optimal concentration. There's a big difference between fixed angle and horizontal centrifuge. The cells move much more easily along the horizontal path versus a fixed angle. And so, I think a lot of people are already doing some PRP. They want to do some PRF. But there's some significant differences there that will result in a less of a quality product if you're using the fixed angle. So I would encourage you to invest in some updated equipment along with the updated research that is available now, because if you're still going by outdated research, then your outdated product. So once the centrifugation has occurred, and we're using specific spin times and rates on these, which has been studied. You're welcome to look at the studies that Dr. Myron has conducted. I think you can find most of that information on bioprf.com, and his papers are readily available for download. So you separate basically the most rich layer out, and then the albumin. The albumin gets heated, and typically each vial being a 10 cc, you get roughly 3 to 5 cc's of material. So you heat the albumin as to not destroy the cells within the concentrate. And once that albumin has been heated, it's just like denaturization of like egg yolks, or egg whites rather. So you see that turn white, gets thick. It's much the same way. You heat it, I think 75 degrees Celsius for about 10 minutes, and it gets to be a thick material that you can then mix back in the viable cells once it's undergone a bit of a cooling process. And then you're ready to inject. Hence the biofiller. So who's good candidates for PRF biofiller? I would say everyone, except for people who have active Cancers, of course, you don't want to concentrate cancerous cells and then inject that. Now you got metastatic carcinoma. But anybody with a healthy body, no active infections. And as you can see here, for full face rejuvenation, Dr. Tacita mentioned Ozempic butt, and we have Ozempic face as well. And so you can just improve skin quality, whether it be acne, or just replenishing lost volumes. So, like I said, just about everyone can benefit. So I'm going to go through a few case studies just to show you some of the things that we're doing. With the advent of this biofiller, it's enabled me to comprehensively treat the entire face and neck if I so choose. You're working against the clock a bit on doing these services, so it might behoove one to split up face and neck. I have done it. It feels a bit rushed. Obviously, you're trying to avoid coagulation while you're injecting, which some conditions seems to precipitate some of that than others. But for the most part, if people come in hydrated, you have a good 25 minutes of working time once the product has been prepared. So this 53-year-old female, she just has suffered some volume loss. She has autoimmune disease, which doesn't necessarily negate her from other fillers, but she personally was wanting something a little bit more natural occurring. And so 2 rounds of biofiller PRF, some neurotoxin, routine facials with our energy devices that we developed through our membership, and you can see that she looks just younger. I mean, she doesn't look like she's overly done in any way. She just looks fabulous, just looks younger, feels better. So I think that's the common goal. Case study 2, men can benefit as well. This individual, a good friend of mine, 61-year-old male, chief complaint was that he experienced volume loss throughout his entire face after a medication-induced Stevens-Johnson syndrome. Fortunately, he didn't develop all the ulcerations that can be associated. However, he just had quite a loss of volume in his face and was unhappy with that. So you can see he's nice and plump now, and he's a fellow who is a country music performer, wants to look nice on stage and feel good as well, feel confident. So again, men benefit just as well. So sometimes we'll get a case that you don't know what to do with. Where do you start? You don't want to just put some nice cheeks on someone and everything else look to be a train wreck. This is a lovely woman that we've known for a long time. I've done lots of different treatment on her. As you can see, combination of threads, lasers. We did 3 rounds of biofiller and PRF. And as you can see, she just looks younger. She just looks better. You don't have to pick out any particular thing, but just overall, she looks better. And she's a lovely, wonderful individual and is happy to feel as good as she looks. So we throw in a young individual here. 35 seems to be about the age when we start losing some mid-face volume. She's beautiful, obviously. I think we might have caught her on a bad day, in the before picture. Wasn't happy about getting her picture taken. Her hair wasn't done and had a hat on, hair day. However, 1 round of biofiller and she's telling us she's loving her face. So, for this one, not using the volume that we use on some of the others, but chin and cheeks here. And just gave her just a softer look, less tired, less unhappy, I suppose. But again, young people alike can benefit. This individual, again, we just love all our patients, and everybody has a story that we've come to know. And it seems as though, I don't know how it is in all your offices, but in the dental office, you're also a therapist. Everybody likes to, tell you all their other problems as well, and we're good listeners. So this person has had some tragic life events, loss of a husband, really depleted, just in and out. And so we were there to not only help her with her journey to improve her appearance, to look once again like Angela Jolie, more so than, well, I won't say, she just was depleted. So threads, biofiller, PRF, we did a little HA filler for lips, neurotoxins, lasers, facials. So like I said, all these comprehensive treatments come together to provide natural looking appearance to individuals that they're completely happy with. So how has this regenerative medicine impacted our practice? So, I mentioned, we have a heavy focus on regenerative procedures. Seems as though they're being requested a lot more, but that was up to us to let people know that we're doing it. So, with that, we're put that, high up on our list of procedures that we provide. We're no longer just chasing down a wrinkle here and there. We're actually able to provide comprehensive treatment and treat the entire face and neck. Increase patient satisfaction. I think somebody comes in, they're wanting to have some improvement. They don't want just one particular area improved, and it's hard to, decide where to stop or where to begin. So with the biofiller, you just know that you can treat the entire face and it's not going to look undone. It's just going to regenerate the tissues that have been depleted and just give a natural appearance of beauty. And then record-breaking numbers. This is probably something that was really not completely foreseen, although Dr. Myron explained, that you got low overhead with this compared to some of the other products that are very costly, and so you have a huge overhead and less return on investment. So again, the return on investment for the equipment has been anywhere for these procedures from 150 to 900%. So I'll bring up the 900%, bring that up specifically because that was something that occurred from just purchasing the proper equipment. In 5 months' time, we paid for that equipment over and over and over again to a point where we had 900% profit. The disposables and sundries are negligible. I think for the 60-some cases maybe that I did in the last 5 months, maybe $1,000 investment for, all the sundries and disposables. So very low overhead. It's your time and expertise involved more so. We got a lot of people coming in looking for that, and then we're looking to see what we're going to do next, and that's just building more membership packages for these services. With the hair restoration and the needleless delivery systems that Sinclair has developed, that I think is going to be probably our next endeavor, and I will be the first one to be in the trial on that. So just a little bit as to how I'm delivering. Generally, I choose anywhere from 3 to 4 port entries to limit the trauma. So I use a 22 gauge, anywhere from 50 to 70 millimeter cannula. I think we get those from Face Medical. And they're wonderful. They don't dive. It's a suitable size. It's for the thick material that we are pushing through. You don't want to just be constantly clearing your cannula. So if you're working against the clock, obviously you want something that's going to handle the product nicely. And the 22 gauge seems to do that very well. Generally, the zygomatic process, I can get to the temples. I can get to the preauricular areas and anywhere in between there. If I'm doing the mandibular space, just above the chin, 1 entry point approximately here. And then for cheeks, I like drawing a line from the canthus to the tragus and entering right about here. And so from those spots, I can deliver the material throughout the whole face, and neck is just kind of the same thing, just wherever I need to go. Cannula work, if you haven't done any cannulas, that'd be the first place to start, although I do utilize some direct depots on bone, but for the most part it's cannula work, and it's very efficient and comfortable over a multitude of shots given. So I would certainly encourage you to look at the research. Just a few things specifically. The horizontal centrifugation is different. The relative centrifugation time and speed is different. So we're doing about 2,000, it's not our RPM because that's just the speed, but calculating in the relative centrifugation rate, around 2,000, and the time is about 8 minutes. So it's really conducive to in-office procedures. Time can be made less depending on what you're producing, but for the biofiller, that time is 8 minutes. And then plastic tubes is a big thing. Glass tubes are going to enable coagulation to occur more rapidly. Plastic tubes are hydrophobic, so they're not going to have the coagulation that you are trying to avoid. And no additives. The cascade of events that occurs during the coagulation process is essential for the healing to occur. So, if you don't allow that to occur by way of having heparin inside your tubes, you're going to have a much less of an effective result. So, again, I would encourage you to find your favorite Sinclair rep, ask them about the equipment, and they certainly can steer you in the right direction. So I've gone over a little bit, so thank you for your attention, and good luck on your journeys.